Passage will start after 5 seconds abruptly. In times of crisis, immense creativity often comes to the fore, precipitating major changes. This has been the case in the coronavirus disease 2019 era. Healthcare technology has leaped to the fore to help healthcare providers manage their patients better by reducing the dangers inherent in personal contact, waiting in crowded waiting rooms or laboratories, and hospitalizations. Artificial intelligence technology is being used in the diagnosis of disease as well as to offer customized solutions. For instance, it is being used to drive systems that process computed tomography scans by the thousands in a mass detection scenario as in COVID 19. This spares radiographers and physicians to attend to patients besides providing supplementary information and thus improving the accuracy of diagnosis and monitoring. Machine learning is being exploited in the pharmaceutical industry to identify new drug candidates without the long and expensive traditional method of sifting through chemical libraries while also replacing actual experiments with simulations varying multiple parameters. The whole process is not only much less expensive but also much faster. Robotic systems are being developed using AI and machine learning to replace humans in the performance of routine, unskilled tasks now being done by skilled healthcare practitioners. This will free them to treat more patients with less time pressure, promoting a favorable outcome. Even as AI is being used to help healthcare, it can be perverted to steal patient and provider identities, divert funds, and misuse information by hacking medical computer systems. This can occur via private systems linked to hospital software or by wireless networks at health facilities or via the Internet of Things. Thus, the protection of such systems from AI driven malware and personalized attacks would perhaps cost more than can be saved by the application of such systems. Meticulous planning, effective training, and ongoing monitoring of healthcare and technical staff as they use data systems as well as installing data security systems are essential to prevent, detect, and plug data breaches as soon as possible. To handle these needs, mobile health information and sensing technologies, termed mHealth, has gained prominence. These tools seem to offer the ability to provide healthcare at lower costs with improved outcomes. They can allow a limited number of providers to monitor more people individually and at the population level. Applications of mHealth can promote healthy behaviors for primary or secondary disease prevention, help with the self management of chronic illnesses, improve provider training, and cut down on visits to the doctor. At the same time, they can help personalize interventions to an unprecedented level. Today, mHealth can be utilized in the form of mobile devices, wearables, and other devices that allow people to carry on with their routine activities while the device sends invaluable data on a host of parameters back to the server. This data can be used both in the present and the future to provide information on all kinds of trends and predictive factors to help research driven efforts to promote and improve patient health. Multiple platforms are now available, backed by top class information technology firms like Apple, to facilitate the development of healthcare apps. Telemedicine is an important innovation now practiced in many countries worldwide due to pandemic restrictions on public travel. With this technology, clinical practitioners see patients virtually, avoiding personal contact while still being able to diagnose and treat patients for a host of illnesses. The saving of time and money has made this an attractive option for both patients and practitioners, and this trend seems unlikely to die down soon. Augmented and virtual reality is being used in novel ways to distract nervous patients from surgical procedures or help train medical students outside the hospital and without the risk of harm to actual patients. A hands-free mode of operation is also enabled, allowing providers to access patient records or other information without leaving the patient or stopping the procedure they are engaged in. The Internet of Medical Things comprises a network of devices and mobile phone apps that track and prevent serious events in the course of chronic illness, linking patients and doctors for better monitoring and management of such conditions. For instance, wearable electrocardiography monitors can allow patients with troublesome changes to be identified early enough to abort heart attacks. Other variables may help monitor fever, blood sugar levels, or pulse. It is estimated that almost a third of the IoT market worldwide will henceforth come from the IoMT, the ability to pair objects in a computer-generated virtual world can help to manipulate both objects at the same time, digital twins. This is important in the plethora of medical devices being marketed today, which are designed virtually in the confidence that the real life object will be exactly like it in every way. Moreover, models can be created for testing, with the results being quite reliable. Remote surgery is also based on this technology, saving time and expenses. The use of blockchain technology is still controversial, but its potential to improve the secure, convenient, and rapid sharing of healthcare information between authorized providers and patients is becoming clearer by the day. The design of this tool allows for large numbers of users without compromising the safety of using a single ledger. This poses a formidable challenge to the current use of electronic health records, putting it alongside the IOMT and cloud computing as a worthy colleague. With patient data being a dynamic thing, it is essential that healthcare providers have a safe and smooth method to share and store this data on which their clinical decisions are based. Cloud computing offers an excellent way out whereby data collection, storage, and management can be achieved using a single point. The resulting improvement in patient care with the saving of time is among the benefits of this approach. The development of nanotechnology has given rise to many innovative systems of treatment. Xenobots or self-replicating tiny organic robots were reported by the end of 2021. A wide range of applications lies open to nanotechnology in medicine, including nanobots for the detection of disease by traversing microscopic blood vessels and nanoparticle drug delivery systems to accurately deliver toxic drugs to the cells that are their targets, avoiding or reducing off-target effects. For medical technology, standards and regulations are needed to ensure safety, protect the public, and guarantee that products are fit for purpose. However, in the context of novel and personal medical technologies, the current approach to regulation is not only infeasible and difficult to enforce but also work against healthcare innovation.